Hi, my name is Denise Liwang from Daily Health and Fitness, and I'm making this video today to explain to you what exactly neurokinetic therapy is and how it can help you overcome aches and pains from musculoskeletal disorders, old or new injuries, or just to improve athletic performance or overall quality of life. So first and foremost, neurokinetic therapy is a sophisticated bodywork modality that can be used as both an assessment and a rehabilitative technique for low back pain, neck pain, whiplash, carpal tunnel, and many other injuries. It uses precise tests and has the ability to change the programming of the motor control center in the cerebellum, so in the back of the brain. When I'm trying to explain this to my clients, I always use the example of how a baby learns to walk. So it's not like the baby tries to stand up once, falls over, and goes, maybe this isn't for me. It's only through many attempts and, of course, many failures that the baby finally learns to walk. But how? The motor control center learns through failure. So there's been some studies to demonstrate that if the brain fails at a task, say, for example, it's a manual muscle test, that area of the brain lights up almost as if it is available for learning. So, okay, we've failed at something, so how can we do better? And this is kind of our entry point and how we can successfully reprogram dysfunctional movement patterns and therefore decrease or completely eliminate pain. So the motor control center learns through failure. It chooses the most successful attempts until standing happens without the baby having to think about it. So conversely, after an injury, the motor control center can adapt to a compensation pattern and can hold onto that in its memory forever unless it's convinced to change. So a good example would be whiplash. I have many clients coming to me from after motor vehicle accidents, moderate to severe whiplash lasting for quite a while. And this is in which the posterior neck muscles, so the muscles at the back of the neck, brace for the anterior neck muscles. And this pattern can last forever unless there's some intervention. So once you've established a muscle compensation pattern, it's not just going to go away on its own. And stretching, say, for in the example of the whiplash, stretching the back of the neck won't do anything to change that pattern. It may serve as like a temporary relief, but it's not going to be fixing the issue. So neurokinetic therapy is an excellent tool to test for muscle compensation, muscle imbalances, and dysfunctional movement patterns. Once we've come across these, we then do a series of tests in combination with medical history questionnaire and all these questions we have for you to determine the facilitators and the inhibitors. Once these have been determined, we can then correct faulty movement patterns by performing release or manual therapy techniques and activation of the inhibited muscles. So it's a very specific sequence of tests, in order to reprogram. So it's really important to know what are the facilitators or the muscles doing the work for others, and what's inhibited, because the body's really good at disguising things, and sometimes you get a test that's weak in the clear, but those can be the biggest facilitators. So it's really important that you go to a certified neurokinetic therapist to get this assessment done. Neurokinetic therapy is also very beneficial for the athletic population to overcome sports injuries, or even better, as an injury prevention measure, or simply to improve your athletic performance by ensuring a biomechanically sound body, or as close as you can get to it, because you're never going to be perfect. Of course, clients need to do their homework in order to permanently burn this pattern into the brain, and those all-star clients who actually do their homework can permanently reprogram those bad patterns, dysfunctional movement patterns, or muscle compensations in approximately 3 to 4 weeks. And it really depends on the person and what their injuries are, where their pain is stemming from, how long they've had this compensation pattern for. But often, those who do their homework can enjoy significant or complete resolution of their symptoms. And finally, the last thing I want to make very clear with neurokinetic therapy is it is awesome because it addresses the causes and not the symptoms of pain. So even to this day, I find a ton of health professionals treating the symptoms of pain. So someone comes to them and they have tight hip flexors, and their first instinct is to assign hip flexor stretches. But as a neurokinetic therapist, I'm concerned about finding out, why are the hip flexors tight? Are they weak and tight? Are they overworking and tight? Because you really need to know that. If you're stretching muscles that are inhibited or weak, you're definitely going to be making your problem worse and not better. So if you suffer from aches, pains, tightness, just generalized discomfort, whether it be in activity or at work, and you think you've seen everyone, you've tried everything, you need to get assessed by a neurokinetic therapist, maybe even one by Dealey Health and Fitness and our team of kinesiologists, because I promise you it's a decision you will not regret. Thank you so much. If you want more information, you can visit our website at www.d-leehealthfitness.com. Thanks so much.